are those that are repeat tests in Arizonans. And so we continue to monitor that and to track where our community transmission is, but we've seen a steady downward decline since our peak back in December and January. So moving on to our vaccine distribution, last week we updated our prioritization model to a hybrid model that includes age groups as well as frontline essential workers as defined by ACIP. As of yesterday, Pima County announced that they are also vaccinating those that are 55 and above. And so you can see that we do have 2 counties that are vaccinating the general population. Some counties have moved on to higher age groups as well, and we continue to work with our counties to make sure that they are getting vaccine. This is updated with data from this week. So our Phase 1A and our prioritized Phase 1B populations, those are our healthcare workers, those living and working in long-term care facilities, our educators and child care professionals, as well as our protective services occupations and those over the age of 65. This week, we were close to 70% of those individuals being vaccinated with at least 1 dose. And looking at those that are 65 and older, you can see that we continue to increase the percent of that population that's vaccinated as well. And you can see the darker red indicates counties that have higher percentages of those populations. These are used on our population estimates, so may or may not include winter visitors in those estimates. Looking at those individuals that are age 55 to 64, you can see that the counties already have a good start into vaccinating this population, likely because many of them fell into one of the 1A or prioritized 1B population. Most of our counties are vaccinating 55 and above, including Maricopa County and Pima County now starting today. This is just a reminder. So one of the reasons that we moved to an age-based prioritization was the extreme risk that age results in those having severe COVID-19 outcomes, so that you can see when you look at our age 50 to 64-year-olds, they are 400 times more likely than their younger counterparts to die, and 35 times more likely, or I'm sorry, that's the wrong column, 25 more times likely to be hospitalized than their younger counterparts. Even those that are 40 to 49 still have a significantly increased risk for hospitalization and death when you compare that to cohorts of the younger population. This is the single most independent risk factor for having a bad outcome from COVID-19. But we also wanted to make sure that we were catching those frontline essential workers. And so those are frontline workers that have to be within close proximity to the public or to other their coworkers or other employees, and their job is critical for our community. And so we wanted to ensure that those frontline essential workers were also prioritized as we moved forward with our age-based prioritization. Looking at our schedule, we anticipate it'll take us about 3 to 4 weeks to move through each of the age groups. Currently, many of our counties are vaccinating 55 to 64-year-olds. That started on March 1st of this year. We anticipating moving to our 45 to 54-year-olds on or before April 1st. We anticipate approximately 3 weeks to get through that group. If you look at the second column from the right, you can see our estimated coverage of all Arizonans with high-risk conditions that would be covered when we include that specific age group. So by including our 55 to 64-year-olds, we're catching between 56 and 66% of all Arizonans that have a chronic medical condition, putting them at risk for severe outcomes from COVID-19. When we move to our 45 and above group, we are estimating that 68 to 79% of all Arizonans with a high-risk condition would be included, and that just continues to increase as we add our groups. We anticipate that we will be on track to meet President Biden's goal of having the population eligible for vaccine by May. So with our age-based prioritization, you can see that we're tracking the percent of the estimated population that has been vaccinated. The state will move to that group. It can move earlier than our estimated if we reach 50 to 60% of the current age group vaccinated. This will apply to the state pods, the pharmacies and FQHCs that are participating in the CDC retail and long-term care federal partnership. Counties are able to move even earlier if 50 to 60% of their age category has been vaccinated, or if they notice that demand slows down, that they're unable to fill appointments as they open them up. Gila County and Greenlee County are already vaccinating their general population, and other counties will be able to move through that as they see fit. When we talk about our frontline essential workers, we are prioritizing those ASIP frontline essential workers that do not meet the age eligibility. So this will be left up to the discretion of our local health departments. They will be able to prioritize using occupational category and other prioritization methods as needed based on the amount of vaccine that they've received. So potential strategies could be used. There could be local health department prioritization. Some of our health departments are going to utilize the Janssen or the Johnson & Johnson vaccine, which is our one-dose vaccine. We have very limited amounts of it in Arizona right now, but we anticipate those amounts to continue to increase. And that could be used on our younger, healthier essential workers, and it will very quickly protect them and keep them safe while they continue to work in those critical positions. Counties are also working directly with larger employers to implement employer-based pods and also community-based vaccination sites so that those employees have places to go to get vaccinated. And we're getting a lot of questions about what frontline essential workers are. So this is a subset. So if you'll remember, ASIP has a definition of a long list of essential workers. We included those in Arizona, as well as the CISA definition of essential workers when we came up with our executive order defining essential businesses and workers. ASIP identified a subset of those essential workers that are at highest risk for work-related exposure because their duties have to be performed on site and they involve being within close proximity of another individual. So that could be public, that could be co-workers. And the examples that they've provided are first responders and correctional officers, which we've already included in our protective services occupations in our priority 1B, as well as education and childcare. But then they also classify food and agriculture, the United States Postal Service, manufacturing, grocery and convenience stores, and public transit such as buses, light rail, rideshare, and taxis. The other essential workers would be moved then into after these frontline essential workers, or could be qualified based on their age prioritization, and that includes a large number of other essential workers. However, the county health departments do have the ability, if there is a significant impact on their community, to prioritize other frontline essential workers as needed. So this is the current prioritization. This is our hybrid method. So our age-based criteria, currently our age groups that are eligible at the state level are 55 and above. But our counties are also working directly to vaccinate those frontline essential workers, and we list those there. And so this is available on our website at azhealth.gov/findvaccine. We saw an increase in the amount of vaccine that we will be receiving for next week. It was about 25,000 additional Pfizer doses, so we were very, very excited. We got a little bit of a bump in our Moderna doses, and we were aware that our Janssen supply would vary over the first several weeks, just knowing that they're bringing up their manufacturing. So we did not get any additional Janssen doses this week, but we are receiving for next week almost 300,000 doses. We are still outpacing our vaccine allocation here in Arizona, but look forward to getting more and more doses. What we're hearing is to anticipate smaller increases through the month of March, and then the first week in April, expecting significant increases in our vaccine allocation. And we apologize, our database, there are a lot of entries for immunizations into our ACES registry. Our ACES registry did not update this morning, so these are the numbers that were posted from yesterday. We anticipate that being resolved and completed this afternoon. And so check back at on our dashboard to get today's updated numbers. So nearly 600,000 doses of vaccine have been administered across the state pod sites. We're very excited that we continue to be able to vaccinate Arizonans, but we have over 1,000 provider sites now statewide that have received vaccine, and that's a large number of different types of providers. Over 1,500 long-term care facilities continue to receive vaccinations through the CDC Long-Term Care Pharmacy Partnership Program. They've implemented over 116,000 doses administered so far. And they continue to work on our second tier of facilities. We anticipate this program will be completed in April. And over 440 pharmacies are receiving a limited vaccine supply through the Federal Retail Pharmacy Partnership Program. That includes Fry's, Albertsons, Safeway, Walgreens, CVS, and Walmart. We continue to work with our pharmacy partners to get even more vaccine sent to our pharmacies so that Arizonans have more options on where to get vaccinated. So we continue with our targeted communications to our high-risk populations. This week, we completed 2 more teletown halls in Spanish and English. They were held on the 9th and the 11th. We continue to push messaging through social media and yard signs and in-community messaging. What we are planning on doing is expanding that outreach to additional communities in Phoenix, Mesa, Yuma, and Tucson. So we continue to work with our partners on developing that targeted communication, and you will see increased high-intensity targeted messaging to more zip codes. One of the exciting things that we rolled out last week and were able to see a completion on this week was our pilot program for registration and transportation to the vaccination sites. So this program focused on high vulnerability areas, that 85009 zip code that had higher COVID-19 cases and lower vaccination rates. We use social media before going out to let people know that we would be making calls and visiting their homes. We called first. If we didn't get an answer, then we would go personally visit the home and sign up those that were eligible for vaccine. If they said that they needed assistance with transportation, we were able to arrange for that trip to the Phoenix Municipal vaccination site. We had over 400 people take us up on that, and we vaccinated them at the site Monday morning and Wednesday morning. So we were very excited. We will continue to work with our partners to overcome transportation barriers and to help people get registered for vaccination opportunities. And again, just as a reminder, the Executive Order 2021-04 was issued on March 3rd. This is, again, that requires schools to return to in-person learning. We will update our school benchmarks every Thursday so that those continue to provide the information that our schools and school districts need. They now align with the CDC's transmission category, and we're looking to update our dashboard so that it's interactive again and aligns with the CDC transmission categories and data sometime next week. So by next Thursday, that new dashboard should be up and functional. And with that, I'm happy to take any questions.
Okay, Director. For the 17th straight week, Cameron has the first question.
Hi, Cameron.
Hi, Dr. Chris. So my very first question today is obviously regarding the president's speech last night. He obviously set a goal that he has in mind. Can you talk to this?
Yeah, so based on our hybrid prioritization and looking at, using our current number of doses that we're receiving as a baseline, we anticipate that it would take us about 3 to 4 weeks to move through each of the age groups, which would put us in line with meeting the president.
You're not like saying we're going to do it no matter what, everybody be ready for May, I assume, but you'd like to see it get there. Are you also expecting it to get there? Because we're starting to see a pattern with smaller counties opening it up a little bit sooner than larger counties. Can you talk to us about what people might put that in perspective?
Yeah, so people in different counties are going to see it differently, just like you said. So, where we've got our more populous counties, that's obviously going to take us longer to get through that vaccine. There's, especially in Pima and Maricopa, where we've got the majority of our populations, they're getting a pro rata allocation of the doses. And so it's the same thing that we have been seeing. So may see them start to move forward into age groups faster than Maricopa or Pima County. Looking at the numbers that we had, we anticipate, though, that we should be able to move the state as a whole along the timeline. So we were anticipating being to 16 and above in May, even before the president made that goal.
I'm so sorry, you were cutting out during some of that.
I'm sorry.
I don't know if it was just on my end, but I'd really like you to repeat the part about what we'll see with less populated counties getting through it faster. And then also on top of that, the last question I would have is, how do we make sure that we're not opening up too early? July 4th was the date that the president said. I know that 50% vaccinated isn't 100% vaccinated, and we're never going to get to 100% nonetheless. But if you could repeat your answer and then address that, and that's it.
Sure. So with those rural counties, we anticipate that some of them are going to be able to move much quicker than our more populated counties. So we wouldn't be surprised if we saw them start to move in. Pima County just moved to the 55 years yesterday. So we will see variability among the counties, and they are the experts, the boots on the ground in their community, and really know those communities best and have a good idea of when they've reached the demand for that and are able to move on.
That's probably under promising. He thinks we can get to a more open and normalized place before July 4th. If you could talk about, is that possible? Can we do that safely?
So what we're hearing is that we can expect slight increases over the next couple of weeks in March, but then on our current vaccine, or I guess like to last week's vaccine, which was even lower than this week's. And so as we get more vaccine, we're going to be able to open it up even more, and more places are going to have vaccine. So, it's really going to be that full protection. If it's Janssen, it's just 2 weeks after that first dose. And then if it's the Moderna, which is the longest, the 28 days, it would be 6 weeks after that first dose. So probably about, end of May, beginning of June, we'll start to see where people are able to get vaccinated as well as be fully protected. And again, we know that we've got about 55 to 60% of Arizonans who said that they would be willing to take the vaccine. That was before any of the giving vaccine.
Thank you.
Thanks, Cameron.
Next, Bud Foster in Tucson.
Hi, Bud.
Hey, Dr. Chris, thank you very much for doing this. We really do appreciate it. I had my second dose about 2 hours ago. So very happy to get that out of the way. So far, no side effects. One of the things that we've noticed down here in Pima County, a lot of people are not showing up for their second doses. Question is, what do you do with those people? And then secondly, how does it affect your ability to fight this virus?
Yeah. So we encourage everybody that they need to get their second dose in order to be fully protected. Now, we know that one dose provides a certain level of coverage. We anticipate it's about 50 to 60% effective. It's not, you don't get that full 95% until you've had your second dose. So we'll be following up. We are seeing kind of the same thing as more vaccine comes into the state as well. What we're seeing is that individuals, even for their first dose, are able to find vaccine appointments at a pharmacy. That to make sure that we're, using the vaccine is opening up any of those vaccination site appointments to our call center each day so that there are appointments available. So we would encourage people to look there, and just reminding everybody that second dose is really important if it's the Pfizer or Moderna, and we are recommending that everybody get that second dose.
How might it affect your ability to fight this virus if people do not do that?
So it could result still in people being able to transmit the virus. Hopefully, even if they had one dose, they'd have less severe symptoms. We know with the 2 doses that it has a very, very good protection rate against hospitalization and death. And so it could cause some issues with still allowing community transmission of the virus if they're still susceptible. It could also cause us issues if we've got people that are still susceptible and variants in the community, and so that could also cause variants to spread. So we would just encourage everybody to make sure that they get their second dose.
And that brings up my final question is the UK variant has now shown up here in Pima County, which the county health officials, we talked with them yesterday, are very concerned about that. What is your concern and how widespread are the variants in Arizona right now, do you believe?
So we are concerned about the variants. We know that viruses mutate, and they mutate to escape our immune system. They're trying to survive as well. So it is worrisome when we do see them. We do have teams that are doing sequencing of random selections of strains, as well as if we know that anybody's had a history of travel to an area that has a variant circulating, and so we continue to monitor. It's likely more prevalent than just the however many we've picked up here, just because they are more transmissible. The good news is that it appears that the vaccine is effective against all of the variants that we've identified.
It's a race to vaccine, get people vaccinated. All right, thank you very much for your time. I really do appreciate it.
Thanks, Bud.
Howie Fisher.
Hi, Howie.
There we go. Good afternoon. Happy Friday, as always. Got three basic questions. I'm going to start off with the fact the CDC's been pretty busy last week or so. They issued some new recommendations for fully vaccinated people in terms of what they can do. They can visit other fully vaccinated people indoors without wearing masks, visit with unvaccinated people from a single household, and refrain from quarantining. What's your thought on that particular recommendation, and are we going to be doing that? Is that your recommendation now?
So we agree with the CDC recommendations. We've felt that in the same circumstances that they're allowing, people to not have masks or to not physically distance when both groups are vaccinated. They seemed very reasonable. They're still recommending not to attend medium to large events, and when you're out in public to still wear your mask even if you are vaccinated. But we thought the recommendations were well thought out based on the information that we have right now.
Okay, that leads to the second CDC recommendation about nursing homes and congregate care facilities. It says unvaccinated residents, you can allow visitation at all times for all residents with certain exceptions, like a certain number of unvaccinated residents. I know there is an advisory committee that doesn't meet till next week. But I'm sure you've had a chance to look at these. What's your thought on those? You've got a lot of people with folks in nursing homes, and I'll include myself with that, who are anxious to do more visitation. What's your thought on the nursing home recommendations?
Yeah, so we are reviewing the nursing home recommendations right now for that advisory group that you mentioned, and we are very pleased that they've become so much more permissive. We've had all of our skilled nursing facilities participate in the long-term care pharmacy partnership program. Many of our assisted living facilities have participated, and people need to be with their loved ones, and they need to visit, and it's been a very, very long time for those individuals. So we were pleased upon first review of those recommendations.
Okay, well, let me ask question 2A before I get to question 3. Then, I know it's a trick. So you're pleased with them. Are they going to be implemented here? Because again, the facility where my mother is has said until we hear from DHS, we ain't doing squat.
Yes, so we're taking a look just to make sure, see what we've got in there and compare. But normally we adopt CMS recommendations. That is a CMS memo that went out to all CMS certified facilities. And so it's kind of the law of the land for CMS regulated facilities. Okay,
and then finally, we're getting to the point where transmission rates are in the low single digits. There are a bunch of facilities that operate as bars who do not operate as restaurants. They didn't install the toaster oven. They've got bar stools. We've got folks on Whiskey Row and 4th Avenue in Tucson and down in Brewery Gulch. When are you finally going to let bars reopen and operate? It has been, a year now? I need to go out, sit on a bar stool, and have a drink.
I'll take a look and see what we can do for you, Howie. The transmission rate, you are right, is getting very, very close. And so we want to try to make sure that we are opening up, as well as, making sure that we're keeping Arizonans safe. But our percent positivity definitely is heading in the right direction.
Okay, right direction. I know. That's you sound like the governor, but you're a good soldier. Thanks so much.
Thanks, Howie.
Josh Sanders.
Hi, Josh.
I have to follow Howie.
Hey, stop that.
I'll take it. Listen. Hey, emergency department data shows a slight but noticeable increase in COVID-related admissions in the last 3 days. Why do you think that is?
So we continue to monitor. I don't know right now that we've got a potential reason for that. That is one of the indicators that we do watch for. Our inpatient and our ICU beds continue to go down. So it could be a number of reasons. That's self-reported data. And so if the hospitals are seeing that and believing that they've got a COVID-like illness or diagnosing it, but they can be managed on the outpatient, it could just be that they're seeing a slight increase. The other thing that we notice is when you look at it, I'm sorry, I lost my train of thought. But the emergency room is one of those that we watch. Sorry?
I'm so sorry. You broke up a little bit too.
Oh, goodness.
Right before you had lost your train of thought.
Yeah, normally that's something that we watch, and we do see that it'll come down and then go back up and then come down again. Usually, what we would look for is a sustained period of increasing emergency rooms. I know sometime during the week it dropped below 1,000. It went back up above 1,000. So we continue to monitor. I don't know that I have a great reason for why that would be. But yeah, we've seen the same thing over the last couple of days.
Thank you. And you do have some Arizona physicians that are on record today saying that they disagree with the governor's executive order lifting capacity limits. Are their concerns valid? They do point to like herd immunity and, we haven't vaccinated enough, and you don't spike the ball on the 5-yard line. You punch it through, what do you think? Are they valid? Are those concerns valid?
I think if we didn't have the other mitigation strategies that are currently in place, they might be valid. But we are still requiring those establishments to enforce mask use, to enforce physical distancing, to use the enhanced disinfection. So even though the capacity limits are lifted, they're still going to be limited by having to have 6 feet in between tables and in between parties or dividers. And so we still feel pretty confident about the mitigation strategies that are still in place.
And again, you believe that Arizona can reach that goal from President Biden of May 1st opening vaccinations for every adult?
Yes, that's in line with our current projections. And so, as long as we continue to get the vaccine and that we don't have another winter storm that delays shipment and stuff, we should be right in line with that goal.
The last question, this is, it's been a collective trauma for everyone, this pandemic, and we've had to change the way we live the last year. As we shift now and turn a corner with the vaccine, do you think that there will be a kind of a new way of, it's affected our mental health, right? A lot of our mental health, people's mental health. As we kind of shift again to a new normal, is the state going to do anything to, maybe potentially, if there are issues when it comes to mental health, are you going to focus on that in any way? Are there any initiatives coming down the pipeline when it comes to mental health in Arizona?
Yes, so we have a couple of initiatives that we'll be launching. One of them is part of our mental health initiative. So we've been working on a social connectedness campaign because we know that loneliness is an epidemic nationally. The other thing that we will be working on is we have several in our Arizona Health Improvement Plan. Mental well-being is one of the top priorities, and there's a number of strategies that they're going to be working on starting this year and going for the next several years to improve mental well-being as well. And those were actually planned before the pandemic hit, and the pandemic has just highlighted and I think shown a lot of people how important some of these needs are, and making sure that you're taking care of your mental health as well. And so we think that we're at a really good spot for these types of initiatives to be launched.
Thank you, Dr. Christ. Appreciate it.
Welcome.
Now, next up is Alexander in Tucson.
Hello.
Hi, Dr. Chris. Hi. Thanks for meeting with us. So my question is, have any inmates in state prisons been vaccinated yet? There's a plan that was circulating that said that inmates in infirmaries and in the special needs unit would be vaccinated March 1st through 5th. Then I have a follow-up, will those inmates who are eligible, will the eligibility be expanded among inmates to those above 55 or any other inmates?
That's a really great question. And we just had an update meeting with our partners at Department of Corrections. So they have started vaccinating in the infirmary, and I believe there's another high-risk unit that they're looking that they vaccinated in, and they are looking to vaccinate along the age-based prioritization, just like the rest of the state. So I believe next week they'll be starting with those that are 55 and above, and then once they get those done, they'll move to the next age group as well.
Okay, and do you have the numbers of people who have been vaccinated, or inmates who have been vaccinated in the Arizona State Prison Complex in Tucson, for example, or just across the board?
I don't have those on me. That might be a great question for ADCRR. They probably know how many they've vaccinated.
Okay, thank you very much.
Thank you.
Next up is Peter Seymour.
Hi, Peter.
Hello, Dr. Christ. Good afternoon. I wanted to ask you about the president's May 1st goal. Did he consult your office or the governor's office, or did a member of his administration consult your office to make sure this goal was feasible?
You know, they get a lot of data from the states every day. I don't know that they've necessarily reached out to talk to us about the goal, but we do upload. You know, they have access to the data. They know how the states are progressing. They know about how many vaccines have been going. I think, you know, luckily in Arizona, we've gotten into a really good vaccination stance, and so we are right in line with their goal. I don't know if they consulted with other states on that, though.
Yeah, I was just curious to see if they were, you know, tracking it on their own or calling you directly. The other question, you said 300,000 doses coming to Arizona next week. Is that across all three brands or just one of them?
So that is across the two brands. So that's the Moderna and the Pfizer. That we're getting, let me see, I think it's like 132,000 Moderna and 161,000 Pfizer doses are coming next week. That does not include any Janssen. So we have not been given an allocation for Janssen at this time. We anticipate getting more the week of the 22nd is what we've been told.
Very good. Thank you very much.
Welcome.
Next up is Juan at Telemundo.
Hi, Doctor. Thank you for your time today. Nice to see you, or I guess you can't see us.
I can't see
but,
you.
But my question is, I guess I have two questions, and if you could just verify it for us or confirm again. Especially me, I'm a little bit confused regarding the difference between the state's run sites and the county. Of course, you know, here in Maricopa County, it feels like they're a little bit behind from what the state was doing earlier. So what is the progress for the state-run sites for eligible people? We have the age groups and then the priority groups. When are essential workers, other than those in 1B, going to be eligible to be vaccinated at the state site places? And also, one of the populations of workers that are, in my opinion, very critical, and a lot of them are Hispanic workers, are the janitors. I haven't really heard about the janitor people being mentioned in the vaccine process. So can you clarify if those people would also be in the priority group or in the essential workers category?
Yes, absolutely. So the state-run sites, there are currently 4 of them statewide. And so that would be State Farm, the Phoenix Municipal, the Chandler Gilbert Community College site, which just transitioned last week, and the University of Arizona site down in Tucson. So those are the ones that we are actively managing. I have teams on the ground at each of those. All of the other sites would either be county or provider sites, or, like healthcare provider sites or pharmacies or the FQHCs. So in Maricopa County, we are vaccinating the 55 and above, as well as those frontline essential workers. At the state sites, we are primarily focused on the age-based prioritization. And that's because that's a very easy process to validate. We can just look at a driver's license, validate the age and get them through. Maricopa County, in order to target those frontline essential workers, is working directly with employers and with specific industries, so like the Restaurant Association, different grocery stores, to schedule vaccination opportunities for their employees specifically. That will continue to expand as we get more vaccine, but the counties are really taking the lead on those frontline essential worker professions. For the janitors, depending on where they work, may have been eligible since 1A. So you'll see when we include it'll say like healthcare workers and healthcare support positions or services. When we're talking about that would be the housekeepers, the janitors, the cafeteria workers, anybody that works at a hospital or a healthcare facility that keeps that facility functioning is eligible for vaccine in those areas. And the same as we moved into our school and childcare, and as we move into some of these priority groups. So if we have an individual that provides janitorial services in a grocery store, they would be eligible. So we would encourage them to speak to their employer to identify if they've been working with the county and if they can be included in those opportunities.
Okay, thank you. So then the state-run sites, you're focusing only on age for your appointments?
Mostly on age at this time. We do have some screening questions that are on there that if they're able to easily answer and identify, they still will be able to, if they are eligible, they'll still be able to see those. So I know that we're still, if there are teachers or law enforcement that haven't been able to get that appointment, they will still be eligible.
Okay, thank you.
You're welcome.
Stephanie Ennis.
Hi, Stephanie.
Dr. Christ, I had two questions for you today. First is when I look at the slide of the 55 to 64-year-olds, and that's as of March 8th, and it looks like in Maricopa County it's almost 24%. Mm-hmm. So you're saying that we could get to 45 plus by April 1st. How hard and fast is that date? I mean, could it be earlier than that? Could we hit 55% of that 55 to 64 before April 1st?
Yeah, so that's our estimation using like if we had 125,000 first doses coming in every week. That's what we use to estimate that, with an estimation of about 55 to 60% of the population being vaccinated before moving on. It definitely could happen earlier. If we start getting, 200,000 first doses, that's obviously going to speed up, and we'll be able to add additional appointments at a lot of our sites and even further speed that up. So it's not a hard and fast date. That's just the estimation of when we believe we will be moving.
Okay, great. And then the second question was just about that 45 plus group. So say we get there late March, early April. How do we all of a sudden then a month later get to everybody 16 and older? I mean, are you going to continue going down? Like, are you going to do 35 and then 25? Or are you going to just do 45 and then open it up after that? So
we would open it up to 45 at the beginning of April. Or hopefully by April 1st. And then it would be about 3 to 4 weeks after that, we would go to our 35 and above. Now, keep in mind, starting the first week in April, we anticipate that vaccine to really, really increase. After our 35 age group, then we jump down to the 16 and above.
Oh, I see. So you go right from 35 to 16.
Yeah.
And you see that happening by May 1st.
We see that happening, by May 1st.
And that's a combination of increased vaccine and ability to administer it, I guess.
Yeah, and as we're looking at it, it's a multi-pronged approach. So, some of the individuals in those groups have already been vaccinated, whether they're teachers, law enforcement, or they're going to be part of the grocery store workers or manufacturing. So we know that we are getting people in those groups. So those groups will continue to dwindle even while we're in the 45 and then the 35 group.
Oh, got it. Okay, great. Thanks so much.
You're welcome.
Next is Brittany Thomason.
Hi, Brittany.
Hi. With the May 1st timeline, would Arizona open up more pods, or would way more vaccine go to pharmacies or doctors to get it out quicker?
Yeah, so I think that's a great question, and it would likely be both. So what we're looking to do is expand the opportunities where people can get vaccines. So, we've got if all pharmacies were fully activated, we'd have over 800 pharmacies statewide that could be administering vaccine. But we also know that we've got healthcare providers that would be willing to administer it. We've got, partners and providers that would stand up community-based sites as well as we continue to get more vaccine. The other thing that we're going to be looking to do, it's going to start getting hot here in Arizona in the next couple of months. So identifying potential indoor locations for our, mass vaccination pods. So we are looking to do that in the next month or so. So you'll see potentially additional sites, but also different sites where it's indoors, where we can keep both our volunteers and our patients safe.
Do you have an estimate on how many more pods the state might open?
So I know that we're looking at one in Yuma and one in Coconino, and potentially adding some other smaller, like community-based pods as we get closer in. I don't have an exact number. We just see what the need still is and how much vaccine we continue to get in.
Okay, thank you.
You're welcome.
Next is Jared at the Mirror.
Hi, Jared.
Hi, thank you for doing this, and thank you for taking our questions. Two quick questions. First question is, you spoke about the 85009 zip code and kind of the program you're doing to kind of help with getting people out there vaccinated. My question is as we're moving into these new age groups and we have more and more people that are going to be needing to be vaccinated, what other zip codes are you kind of looking at to maybe expand this program, and what are you doing to maybe make sure that that program is expanded in a way that is equitable and, able to be expanded in a way that works?
Yeah, so we are looking at our zip code based data as well as our case data. And so the next area that we are looking to move into with this high intensity targeted communication, I apologize, I don't have the zip codes memorized, but I believe it's Phoenix City Council District 7 and 8. Which is a number of different zip codes that are included in that. We're also looking at a area in Mesa and Yuma, and then they've identified some areas in Tucson. But the next areas that we're moving to are that Phoenix City Council District 7 and 8 and Yuma. And so we'll continue to expand as we get additional vaccine and additional resources. And as we continue to expand and, go down in our age groups, those age groups would be included in any of those activities that we did.
And then my second quick question is kind of on that age group issue.
Yeah.
When you look at the data, you see that, the largest group of people that are hospitalized and that are being impacted the most are our older generation. But the people that end up getting infected the most are our 25 to 44 age group. Is there an argument to be made that we should be trying to vaccinate that age group quicker because they're the ones that are the infection vector when it comes to this virus? They're the ones that are infecting those older age groups and putting them in the hospital.
And so that's a great question. As we've got that limited resource, you really look at what's going to have the biggest benefit in saving lives. So that's why we prioritize those older age groups, because they have such a huge disparity when you look at the rate of hospitalization and the rate of death as you get older. With our younger population, they tend to be more asymptomatic. So even if they get it, they're going to be less likely to be hospitalized or potentially die from that. We do know that they could pass it on to an elderly family member, but that's why we have been working so hard to get our elderly population vaccinated first. So even if somebody has it and doesn't know it and visits with a loved one, that loved one is protected from those severe outcomes.
Thank you.
You're welcome.
Nicole Garcia.
Hi, Nicole.
Dr. Chris, thanks for taking all our questions. Mine is about herd immunity. We had a group of doctors talking about let's not move too fast to reopen schools or establishments. Let's wait until we get to about 70 to 90% of immunization in the population. What's your thought on that mentality? What's your thought on herd immunity? And given your estimate at hopefully opening up vaccines to everybody 16 and over by May, do you have a long shot estimate of a possible herd immunity date?
So we're looking to get 70% of Arizonans. That's where we'd like to be for an initial herd immunity. That's one component, I think, of controlling the spread. For instance, like if we look at our schools there have been schools that have done a phenomenal job implementing the other mitigation strategies. And school actually isn't one of the places where we've identified a lot of like in-classroom transmission. And so there are ways to bring people back together and do it safely. Vaccine is one more element that's going to protect those most at risk. I wish I had a great estimate on when we would reach herd immunity. I'm hoping that by the summer we'll have that 55 to 60% of those people who said, yes, I'm going to take that vaccine when it's available to me. I think then getting past that, we're going to have to do more education and more outreach to reach that 70. So I think once we hit those that were a definite, our pace is going to slow down a little bit, because then we're going to have more supply than we have demand. Maybe by the fall. It's hard to say right now.
Okay. Hang on a sec. Then our last question is from Jonathan Cooper from the AP.
Hi.
Hi, Dr. Christ. You talked at the beginning about the small counties that have opened to the general population. And I'm wondering what's going on there. Do those counties get a large allocation relative to their population, or is it hesitancy that people aren't interested in, so they're trying to fill their appointments by making more people eligible?
So I think it's a combination. We have been providing vaccine on a pro rata per eligible population basis. So the counties haven't really received like a large compared to their population. But some of the counties early on partnered with healthcare partners, provided large vaccination events, and were able to get the vaccine out relatively quickly, which then I think let them get to the point of where demand then was able to kind of drive them opening up. So with some of those smaller counties, as they continue to get vaccine, they're having less and less demand within the county. So they've moved through those groups and just have it open to everybody now.
So you're not really seeing evidence that people don't want hesitancy?
Well, I think, if you look at the percent of the population, like in some of those counties that have opened up just because they weren't able to fill some of those appointments, those rates, they didn't reach, like when you look at some of them, they weren't at the 55 to 65%. But as they were limiting to that and opening up appointments, they just weren't getting full. So I think that does have some element of either hesitancy or just people not wanting to get it at this time, and maybe wanting to see, have a little bit more data or see how loved ones or neighbors were impacted by the vaccine.
And then just follow up to that you'll be looking at zip codes at the intensive targeted outreach at some of the zip codes in West Phoenix. Do you have a timeline for that and Mesa and even all the places that you mentioned? How long is it going to take you to really ramp up that super targeted intensive outreach?
Oh, goodness. I want to say it's in the next couple of weeks. So I think it's pretty quick.
Okay.
Yeah.
Thank you.
You're welcome.
All right. And that's all the questions, Dr. Christ. Thank you, everybody, for joining us today. Thank you, Dr. Christ.
Thank you. We'll talk to you next week.
Thank you very much.